it's still a lot easier to write a prescription. And I understand that, but the key is kind of raising awareness in those docs of, this is an option. Don't make this last resort. We've always kidded, if there was a pill form of the diet, it'd probably be, first, second, or third choice for a lot of conditions. We just got to elevate the diet itself to that position. So I think still one of the challenges and one of the things we see is, education still is a critical component with the diet, because you can't, just go to the store. I can't write a prescription. It's education of the family. The family has to embrace it and do it. But that also education is healthcare providers too. So I've got to have nurses that are educated, so when the family's asking them questions, they know how to do it. We've got to have medical students that have heard about it in their education. They can't finish their career and think, oh, I sent you to a specialist and he just said change your diet. That doesn't sound like a specialist, something a specialist would do. So I think there's still a huge educational component, and I think that sometimes gets overlooked because people say, oh, it's just diet. I mean, it's not, how can it be that complicated? But I think we really still have a ways to go to get that out there for all physicians. It's education, it's family practitioners, it's pediatricians, it's internists. So if they send a patient to the neurologist and they see that same patient back, they know, first of all, I can't give them an antibiotic that's loaded with sugar if they're on the diet, but also so they don't kind of downplay the diet when the kid comes back with the idea that, gosh, we sent you to the specialist and he put you on a diet and even put you on a medicine, and think, okay, what kind of doctor is that? So I think we have a ways to go to kind of educate kind of our general care docs that this really is an established therapy. It's a good therapy. It works. And that they need to have awareness. They may not have to know how to do it, but at least an awareness that this is an effective therapy. I don't think that awareness is there yet.